The World Health Organization just confirmed that they suspect a rare virus is spreading person to person on a cruise ship stuck in the Atlantic, and no country is letting it dock. So there are 149 people from 23 different countries trapped on the ship right now. 3 different passengers are already gone. There's 1 more in intensive care right now, and there's at least 3 more suspected cases on board, with 2 crew members showing symptoms right now. The virus is called Hantavirus, and it normally only spreads from rodents to humans. But the World Health Organization just said today that they believe that it is now starting to spread between people on this ship, which would be incredibly rare.
7 individuals of the 147 passengers and crew have been reported ill. Sadly, 3 have died. 1 patient is in intensive care in South Africa, while 2 patients are still on board the ship and are being prepared for medical evacuation.
If that is confirmed, it would mean that the virus is developing the ability to jump person to person, and that changes everything about how dangerous this situation actually is. There is no cure, there is no treatment, and no vaccine for hantavirus. All the doctors are able to do on the ship is put you on oxygen and wait. Every single country that is near the ship has refused to let it dock because they don't want the virus reaching land. Spain actually just offered to take the ship to the Canary Islands for a full investigation, but as of right now, not a single person has been allowed off. 149 different people, no treatment and nowhere to go, and this is happening right now.
3 people are dead on a cruise ship in the Atlantic, and 3 more are now fighting for their lives. And the suspected killer is a virus you catch by breathing called Hantavirus, and rodents are known to be the main vector. And we don't even have to touch them to get sick, because we could just get sick by breathing in the air that's around their dried droppings or their dried urine, which then causes fever, coughing, flu-like symptoms, and then if it gets worse, failure of the hearts, of the lungs, and of the kidneys. And there are 2 strains of hantavirus. One strain isn't known to spread from person to person, and this is the one that killed the wife of actor Gene Hackman earlier last year. But there is a second strain called the Andes virus, and this is found in South America. And this one can spread between people, which is why everyone is watching what's happening right now, because that cruise ship, the MV Hondius, sailed from Argentina about 3 weeks ago. It's now anchored off the coast of Cape Verde.
I am currently on board the MV Hondius, and what's happening right now is very real for all of us here. We're not just a story. We're not just headlines. We're people. People with families, with lives, with people waiting for us at home. There's a lot of uncertainty, and that's the hardest part. All we want right now is to feel safe, to have clarity, and to get home. So if you're seeing coverage about this, just remember that there are real people behind it, and that this isn't something happening somewhere far away. It's happening to us right now.
CNN is reporting that the lethal hantavirus has now been confirmed to also be infectious, with the WHO releasing this list of the most common symptoms and what to immediately do if infected. Quick recap: a severe outbreak of the hantavirus has occurred on a cruise ship holding around 170 passengers. It's been confirmed that at least 3 individuals have already perished, with officials barring anyone on board from disembarking out of fear of further contagion. Doctors in the World Health Organization are now warning that the hantavirus is a fast-moving virus with a 38% mortality rate, and that it primarily spreads through direct contact with infected rodent droppings. But there are also cases of human-to-human transmission for specific variants of the virus found in South America, where the cruise ship originated. Currently, there is no vaccine, and infection can be hard to identify, as symptoms start out with simple headaches, chills, and muscle cramps that last for a few weeks before rapidly worsening into severe respiratory failure within days. And while immediate hospitalization may help, there is no proven cure.
Guys, we officially have an update. The virus on the cruise ship just got confirmed to be the 1 strain that can spread person to person. And a passenger who left the ship early just tested positive in Switzerland. So the virus on that cruise ship is now officially confirmed to be the Andes strain of hantavirus, which is the only strain plane in history that has ever been able to spread between humans.
Hantavirus from the cruise ship stricken with a deadly outbreak of the disease. And meanwhile, experts are confirming there have been cases of a rare strain on the ship that can be transmitted between humans.
And a passenger who got off the ship at a stop before anybody even knew about the outbreak just showed up to a hospital in Switzerland and tested positive. His wife is now in self-isolation, and they are now tracing back every single person that this guy may have been in contact with. 3 more people were just airlifted off the ship today and are now being transferred to hospitals across Europe. The total number of cases is now officially at 8, and 149 people are still on board and have nowhere to go. In my update yesterday, Spain actually just told the Canary Islands to take the ship in, but the president of the Canary Islands just went public and said absolutely not, we do not know what we're dealing with. So the one place that was supposed to take the ship in just basically went back and said no too. I'm watching this entire story and I will obviously keep you updated, so make sure you add me now so you don't miss it.
I'm back. Listen, I think at this point we can all agree that that ship needs to sink. They need to let that ship go down. Collateral damage, and I think they need to take one for the team, right? And by the team, I mean the world. Tatahasi swimming with the fishes.
I'm not one to fearmonger, but we can't let them people off that ship, especially us people in New York City. They got that Hantavirus from Argentina, where they're going to be having multiple games and with the World Cup, and they're bringing that to Kansas City and then to New York City. New York City is not ready for a Hantavirus, okay? We got people who refuse to pick up dog shit from their own dog. We walked around with dog shit on sidewalks and streets all winter long, okay? Not only that, the rat problem, the rat infestation, the way they said that this thing is spread is through rodents and possible person-to-person contact. We got people where you don't even know what type of filth somebody's living in New York City. No tea, no shade, but some people be really living in deplorable conditions in this city and you wouldn't even know it. They just be acting like mouse being in their house is just a normal everyday thing. Rodents being in their house is a normal everyday thing. Listen, New York City is not ready for no Hantavirus. Keep them people on the ship, okay? I'm sorry that y'all had to go through this, but it seemed like you had a great life to be able to afford a trip like that when you're leisurely going to remote islands. Good riddance.
I know we're all pretty much in agreement already about that boat that has the Hantavirus on it. Like they cannot get off that boat until that is handled. I know we all agree about that. But wouldn't it be literally crazy if, you know, they did, or all was cleared and then it still ends up happening. Praying to fucking God it doesn't. But wouldn't it be crazy if we had a second pandemic in the span of a decade and they both happened under the same pedophile US president under 2 separate terms? Like that actually sounds like exactly what would be expected to happen. You know, like I'm sitting here being like, yeah, like they totally cannot get off that ship. Like we can't do that again. But at the same time, I'm like totally preparing for that to happen. Like, don't get off that ship, y'all. But at this point, I've kind of already accepted the fact that like it doesn't even matter if y'all do or not. Happy birthday to me.
Hantavirus is traveling, and if it reaches the United States, it will be a disaster. I'm not saying this to scare you or to fearmonger or to say it's already here. No, we do not have the infrastructure in place to properly respond or monitor any sort of outbreak here. There have been massive funding cuts across the board, and the CDC has been gutted. We've left the World Health Organization, who is actively doing contact tracing right now, and we've seen who's in charge of health overall and who's in charge at the top. Remember what happened in 2020? That's why I say it's going to be a disaster. We don't have the infrastructure to properly respond, monitor, and surveil outbreaks like this. I follow Laughter and Light PhD. She is an epidemiologist and gives great information in a way that is easy to understand and not to scare you. I woke up this morning, her concern level was a 1 out of 10. Later that morning, it went to a 4. Why did that happen? There are now 8 cases. Most of them are still tied to that one cruise ship, except for one. He was on a flight with the man from Switzerland who had been on the ship. That's the case from France. It was transmitted on an airplane. Okay, that is a worst case scenario for any sort of viral or disease outbreak, air travel. If she raised her concern level to a 4, I'm raising my concern level to a 4, and I suggest you follow her for more information and updates because this is going to change. And if a case arrives here in the United States, I honestly don't think the response will be adequate, and I think people will be harmed or worse unnecessarily. And I think, honestly, the administration will use it to their advantage. Absolutely. They're looking for a reason to take control. That's just my personal opinion. But we've seen how they responded in 2020. It wasn't great. Do you think it's going to be any better now?
As a person who was an essential worker and worked during the entire ordeal of COVID, I am telling you right fucking now, I do not have the capacity to deal with another fucking pandemic right now. There's too much shit already going on. It's already so fucking crazy that another pandemic would probably just fucking send me over the edge, bro. I can't be an essential worker during another pandemic. I literally cannot. We can't do this again. We have to take whatever measures to prevent this because we can't do this again. I can't fucking do this again. Fuck.
All y'all had to do was keep that hantavirus on that boat. And y'all telling me y'all let him off the boat. Y'all let them get on the plane. Y'all let them fly on a plane with more people. And now they got that shit in Switzerland. And now they're trying to backtrack. Who else got it? And where they're going. And for all the people that's saying, well, we don't got to worry because it's only through animals. It's not only through animals. This is the rare case of hantavirus that can be transmitted from person to person. Right? But of course it is. Of course it is. Because every few years we have to have a pandemic. We have to have something that just fundamentally disrupts everything. So now they got an excuse to lock us down. Now they got an excuse to limit our speech and put us in quarantine, right? They have a reason, right? Now we got something floating around that has a 30 to 50% chance of killing you. Ain't that some shit? We have enough going on. Y'all can't do shit right. And you know what's the kicker, right? They took more funding from the CDC. We have less people helping us than we did before.
The Hantavirus will not become a pandemic. Let me explain. Despite various TikTokers out there and people on social media claiming that this Hantavirus that was on a cruise ship is going to become the next world pandemic, it's not. First of all, in order for there to be a pandemic, a virus has to be able to travel very easily, particularly through the air. And what we know about the Hantavirus is that is not the case. Most of the time, it's transmitted from rodent to human, and it can be easily contained. And yes, although the Hantavirus can travel from human to human, that would require prolonged exposure from one human to another, and through the exchange of bodily fluids. There is only one type of Hantavirus variant that can travel through the air. However, the transmission rate for that variant is about 50% versus the transmission rate of COVID, which was about 90%. And the other thing to consider about hantaviruses too is that people get sick quicker. Unlike COVID, where someone could have COVID for days or even weeks before they show signs of it. And the fact that symptoms of hantavirus shows up pretty quickly means that it can be treated quicker. Treated quicker, which means less chance that it will spread. And for those with hantavirus, most likely will seek medical attention, which means that they are not traveling. Unlike COVID, where people didn't know they had COVID and they were just traveling everywhere. So stop believing the fear-mongering that's on TikTok. The Hantavirus will not become the next pandemic.
So you're telling me that it's possible that another pandemic could happen, and RFK Jr. is in charge of the Department of Health? Why is it always the worst people that are in charge when potential shit like this pops up? Why?
Nearly 150 people are trapped on a ship with a deadly virus, and they've just been refused to dock to protect national public health.
I am currently on board the MV Hondius, and what's happening right now is very real for all of us here.
So what the hell happens to them now? Well, two big mysteries likely need to be solved before any country is willing to take the risk and allowing them to dock. The first is how this virus outbreak even began, and the second is which strain of hantavirus is this, because that can change the risk profile. The WHO fact sheet states that while there are multiple hantaviruses, there's one strain native to South America which has been documented to pass from human to human. But even so, it is rare for this to happen, and it requires close and prolonged contacts. The WHO also say that cases of this strain are primarily found in Argentina and Chile. Argentina is where the ship originally departed from. So as you'd imagine, for the people stuck on that ship, it would be pretty terrifying knowing that 3 people have already died, which were an elderly couple from the Netherlands and a German national. Several others are currently ill, including a British national in critical condition in a South African hospital, and 2 crew who are also set to be medically evacuated. But in saying all of this, it's very important to stress that the risks of this becoming 2020 season 2 is very low. The WHO confirmed this based on what is known about the virus's transmissibility. There are currently no plans for disembarking yet, but the ship is currently considering sailing to Spain's Canary Islands. As things develop, I'll keep you guys updated. Okay, breaking news. Switzerland have just confirmed a case of hantavirus. And it's kind of a good news, bad news situation. The good news, let's start there, is that the person who tested positive was on the cruise ship when the outbreak happened. So fortunately, currently, we are still within this bubble of ship passengers. Now, the bad news is that the test results show that it is the Andes strain. That's the one that can very rarely go from human to human. Now, South Africa, hey guys, so you guys got wrapped up in this. They are also saying that 2 patients that they have tested, which were also from the ship, have the Andes strain as well. But again, no need to currently panic because this is not like season 1. Now, I don't want to detract from the seriousness of this disease and the fact that lives are at risk, but if I can offer you any peace of mind, it's that you're not going to wake up tomorrow and hear that they've called a lockdown, and you're not going to get any time off school. So
if hantavirus is not normally transmitted from person to person, how is it possible, do you think, that multiple people on the ship have the virus?
Yeah, a hantavirus outbreak on a cruise ship was not on my top 50 or even 100 things that I would worry about for a cruise ship. I and other experts really think there are 3 possibilities here. The first is that a bunch of folks were exposed when they were traveling off the ship. Maybe they went to a cave or to a house that had rodent droppings that got aerosolized and they all got infected there. The second possibility, which would worry me if I were a cruise ship owner, is that there were mice or other rodents on the cruise ship that were running around and exposed a bunch of folks. The third possibility, and the one that most worries folks like me, public health experts, emergency physicians, is the possibility that there could be person-to-person transmission. And Jake, here's the important part. There has been a report of 1 strain of hantavirus in Argentina, known as the Andes strain, which is known to cause limited person-to-person transmission. Many of us are worried that it may be that strain that got onto the boat and that may be spreading, but it's far too early to know.
The hantavirus affecting the cruise ship appears to be the Andes variety, which goes human to human. This is devastating news because the hantavirus has a lethality rate, a mortality rate of 15 to 40%. 3 people have died currently of the 8 people that are infected. 3 of the individuals on the ship are being evacuated to the Netherlands for treatment. 1 of them is in very bad shape. This is an RNA type of virus, which means it mutates quickly. Think influenza, think COVID, which means a simple vaccine won't protect you forever from this. You will need boosters if this comes into our society. And if it comes in as deadly as it is, we are looking at a plague far worse than the Spanish flu, far worse than COVID, and far worse than many of the plagues we have seen. This at a time when the United States is withdrawn from the World Health Organization. And right now we are depending upon the World Health Organization to keep our shores safe. It used to be we would be sending the Centers for Disease Control and its scientists there who kept our shores safe from Ebola. But alas, we can't do that because we have devastated the Centers for Disease Control, firing a number of the scientists who would do it. This is not a time to play politics. This is a time when we need the scientific community to come up quickly with information to keep us safe.
So far, the risk to the rest of the world is low, and we're trying to do our best. We have already now some medics, who joined the ship, including staff from WHO, and we will continue to monitor and support the people in the ship, and also monitor the situation outside that.
We are not in an emergency situation like at the beginning of the COVID for the moment.
No, I don't think so.
The World Health Organization just confirmed that they suspect a rare virus is spreading person to person on a cruise ship stuck in the Atlantic, and no country is letting it dock. So there are 149 people from 23 different countries trapped on the ship right now. 3 different passengers are already gone. There's 1 more in intensive care right now, and there's at least 3 more suspected cases on board, with 2 crew members showing symptoms right now. The virus is called Hantavirus, and it normally only spreads from rodents to humans. But the World Health Organization just said today that they believe that it is now starting to spread between people on this ship, which would be incredibly rare.
7 individuals of the 147 passengers and crew have been reported ill. Sadly, 3 have died. 1 patient is in intensive care in South Africa, while 2 patients are still on board the ship and are being prepared for medical evacuation.
If that is confirmed, it would mean that the virus is developing the ability to jump person to person, and that changes everything about how dangerous this situation actually is. There is no cure, there is no treatment, and no vaccine for hantavirus. All the doctors are able to do on the ship is put you on oxygen and wait. Every single country that is near the ship has refused to let it dock because they don't want the virus reaching land. Spain actually just offered to take the ship to the Canary Islands for a full investigation, but as of right now, not a single person has been allowed off. 149 different people, no treatment and nowhere to go, and this is happening right now.
To put it in the most blunt terms possible, COVID-19 had a death rate of less than 1%. 6.8 million people worldwide died from COVID. 1%. The hantavirus has a death rate of between 35% and 40%, meaning 1 out of every 3 people doesn't survive. That's why everybody's talking about it right now. But let's continue to talk about it. The cruise ship originated from South America. It is currently docked off of the coast of South Africa. Currently, there are 3 people who have died. There are more people being testing positive. There is a case in Switzerland. They're doing the contact tracing. They are doing the quarantine things. They are doing all of the things that they possibly could to do to contain this so that it does not become another global pandemic. But that's all outside of the United States. Inside of the United States, we have somebody who brags about snorting coke off the back of a toilet seat, who's in charge of leading this if it gets here, and a president who last time there was a pandemic told you to shoot bleach in your veins, and people did. So on top of inflation, on top of food shortages, on top of an energy crisis, on top of growing and mounting tensions in the Middle East because of the United States and Israel, we're now potentially going to add a pandemic on top of this. And here I thought I could get rid of all of those masks. Silly me.